Pregnancy is a time of incredible transformation, a delicate dance between a mother and her developing child. Within the womb, a remarkable substance called amniotic fluid plays a crucial role in nurturing and protecting the growing fetus. This fluid, often described as the water that breaks before birth, is far more than just a cushioning agent. It is a dynamic environment essential for fetal development. Amniotic fluid is a clear, slightly yellowish liquid that surrounds the baby in the womb. It is contained within a thin-walled sac called the amniotic sac. This fluid serves as a protective barrier, cushioning the fetus from bumps and jolts to the mother's abdomen. Imagine a baby floating weightlessly in a warm, comforting pool. That's the environment amniotic fluid creates, but its role extends far beyond protection. Amniotic fluid is a vital component of fetal development, allowing for free movement and promoting healthy musculoskeletal growth. It helps the baby's lungs mature and prevents the umbilical cord, the lifeline between mother and child, from becoming compressed. This incredible fluid also plays a crucial role in maintaining a stable temperature within the womb, protecting the baby from temperature fluctuations outside. It even helps prevent infections by acting as a barrier against bacteria and other harmful microorganisms. As the pregnancy progresses, the amount of amniotic fluid present in the womb naturally fluctuates. In the early stages, the fluid is primarily composed of water from the mother's bloodstream. As the pregnancy advances, the baby begins to contribute to the fluid volume by swallowing and excreting it. Amniotic fluid levels gradually increase throughout pregnancy, peaking at around 36 weeks. At this point, the average amount of fluid is about 800 to 1,000 milliliters. After 36 weeks, the fluid volume gradually decreases until delivery. These fluctuations in amniotic fluid levels are entirely normal and essential for the baby's well-being. Healthcare providers closely monitor these levels throughout pregnancy using ultrasound scans. This allows them to ensure the fluid volume remains within a healthy range. Ultrasound technology provides a window into the womb, allowing doctors to visualize the baby and measure the amniotic fluid pockets around the baby. By assessing these measurements, healthcare providers can determine if the amniotic fluid levels are within the normal range for the gestational age. While amniotic fluid is crucial for fetal development, there are instances where the levels can become abnormally high. This condition, known as polyhydramnios, occurs when there is an excess of amniotic fluid in the womb. Polyhydramnios is relatively uncommon, affecting about 1 to 2% of pregnancies. It can occur at any stage of pregnancy, but is more frequently diagnosed in the second and third trimesters. There are several potential causes of polyhydramnios. In some cases, the underlying cause remains unknown. However, it is often associated with maternal conditions like diabetes, multiple pregnancies, twins or triplets, and fetal abnormalities. Fetal abnormalities, such as those affecting the gastrointestinal tract or central nervous system, can sometimes interfere with the baby's ability to swallow and process amniotic fluid, leading to its accumulation. Section 4. Recognizing the signs. Symptoms of polyhydramnios. Polyhydramnios doesn't always present noticeable symptoms, especially in mild cases. When symptoms do occur, they can vary in severity and may include abdominal discomfort, which is a feeling of tightness or pressure in the abdomen beyond what's considered normal for the stage of pregnancy. Rapid weight gain, an increase in abdominal size that seems disproportionate to the pregnancy's progression. Shortness of breath, difficulty breathing, particularly when lying down, due to the pressure from the enlarged uterus on the diaphragm. It's important to note that these symptoms can also be associated with other pregnancy-related conditions. Therefore, it's crucial to consult a healthcare provider for an accurate diagnosis. Section 5. Uncovering the cause diagnosis of polyhydramnios. Diagnosing polyhydramnios typically involves a combination of a physical exam and an ultrasound. During the physical exam, the doctor will assess the size and shape of the uterus, checking for any unusual enlargement. An ultrasound is the most effective way to confirm polyhydramnios. This imaging technique allows healthcare providers to visualize the amniotic fluid pockets and measure their depth. If the measurements exceed a certain threshold, a diagnosis of polyhydramnios is made. In some cases, further investigations such as blood tests or amniocentesis may be recommended to identify the underlying cause of polyhydramnios. These tests can help rule out potential maternal conditions or fetal abnormalities. Section 6. Navigating polyhydramnios, treatment and management. The management of polyhydramnios depends on the severity of the condition, the stage of pregnancy, and the underlying cause. In mild cases, close monitoring may be all that's required. Regular ultrasounds help track amniotic fluid levels and assess fetal well-being. For more severe cases, or if the mother experiences discomfort, treatment options may include amnioreduction, a procedure where excess amniotic fluid is drained from the uterus using a needle inserted through the abdomen. This can provide temporary relief from symptoms, but may need to be repeated. Medication. In some cases, medications may be prescribed to reduce amniotic fluid production. This is typically considered when the underlying cause is identified and treatable with medication. In situations where polyhydramnios poses a risk to the mother or baby's health, early delivery may be recommended. This decision is made carefully, considering the baby's gestational age and the potential risks and benefits of premature birth. Section 7. A positive outlook, ensuring a healthy pregnancy. A diagnosis of polyhydramnios can understandably cause anxiety for expectant mothers. However, it's essential to remember that with proper medical care and monitoring, most women with polyhydramnios go on to have healthy pregnancies and deliver healthy babies. Regular prenatal checkups, open communication with healthcare providers, and following medical advice are crucial for managing polyhydramnios and ensuring the best possible outcome for both mother and baby. Pregnancy is a journey filled with anticipation and wonder. While challenges can arise, access to quality medical care and a supportive network can make all the difference in navigating these challenges and welcoming a healthy baby into the world.